Michelle, thanks. Time right now is 8:43. Now, while healthcare industry continues to battle the weight of COVID-19, certain specialties like dentists, they're having to change how they meet clients. Here to talk about it with us is Dr. Ron Wilson of Greenville Smiles. Doctor, thanks for joining us this morning.
Hey, Ted. Thank you for having me.
Oh, always a pleasure. Now, the first question, I know some folks, they may still be hesitant to visit the dentist or other specialists in terms of the close contact. What are some of the extra precautions you've been taking in order to keep people safe?
Well, the medical industry has done a really good job of presenting how safe it is to come back to have necessary treatment and routine care taken care of. The dental industry hasn't been quite as aggressive in doing that as of late. But just to know, like in my office, for instance, we don't allow any patients to come into the office without a pre-screening with temperature, pulse, and their oxygen saturation. Then we have them fill out a fairly lengthy questionnaire about symptoms, whether they've traveled outside the U.S. or if they've, lost sense of smell, runny nose, things like that, dry cough. Once they're inside, we're all wearing KN95 or N95 masks, face shields, and the body garments. Mm-hmm. And then afterwards, we're doing the typical wipe down that we would with our antiseptic wipes. We've instigated using what's called cold fogging technology, which is it mists a mild hydrochlorous acid over everything that's non-corrosive. And yet it kills, I think, about 99% of all bacteria and viruses.
Wow. Yeah.
And now I'm also bringing into the mix technology. There's a Greenville company called Net Zero USA that I'm beginning to prototype model of theirs to wipe out. It kind of just looks like this, and you turn it on. Doesn't look like much.
Oh, wow.
But the wavelength of that light, if you leave it on a surface for about 10 seconds, kills everything, including the COVID-19 virus.
Yeah, and that's amazing with all the steps there and taking all the precautions that you need to in order to keep everyone safe. Glad to see that, especially the new technology with the UV rays. Have you seen a drop in the people coming into the dentist office at all?
Well, when everything started opening back up, there was actually a boom, and we were really swamped. Now it's kind of tapering back off a little bit. The ADA seems to estimate it being about we're operating at about 70% capacity now. Mm-hmm. That's really not great. That's actually destructive thinking in a lot of ways, because people are getting, it's acting like people are getting scared to come back in. The problem is that routine care is really necessary for taking care of problems that may become problematic in the future. And there's also now links showing that there's studies showing that the severity of a coronavirus infection could increase based on your oral health or lack of oral health.
Oh, wow.
Untreated gum disease, untreated decay produces, it's caused by bacteria, and it also produces an immune response. Well, the proteins from that immune response or the bacteria themselves, if they are aspirated, can cause a pneumonia, which is what really causes the major problem in COVID-19 mortality is the acute respiratory distress syndrome.
Yeah, and really quick, as we have a few seconds here, Doctor, for some people that are still concerned to come into the dentist or whatnot, what is the most important thing for their oral care at home until they can see you once again?
Brushing, always. Flossing. You got to get the floss in there and clean up under, between the teeth and under the gum line. And really using an oral rinse, sort of like Listerine, something that's going to that has been proven to kill bacteria in the mouth. Anything like that can reduce the overall bacteria load that you've got is really important and really key to maintaining your oral health and trying to stay healthy during these times.
Absolutely. Well, Dr. Wilson with Greenville Smiles, we appreciate you being on this morning. Thank you so much for that information. Have a good one.
You too. Thank you.
Yep. Right now, we're going to get a look at the forecast with Isaac and find out what to expect for this Thursday.